I've been in Louisville now for 17 plus years. My specialty is hip replacement. I've been doing nothing but hip replacement for the last 17 plus years here in Louisville. I teach a lot throughout the country, and I get a lot of information and education from other surgeons that are doing a ton of hips and that are very bright minds in this field. And one of the things I think that has probably been the biggest change in my practice for the better is simply the incision I make on the skin. So one of the problems with anterior approach hip replacement is that the traditional incision is made in a longitudinal fashion, meaning up and down with the leg or parallel with your leg. In a lot of folks, that incision crosses the hip crease. So you know when you sit in a chair and your leg bends, there's going to be a crease on the front side of your hip. Well, that skin crease, if an incision is taken across it, that's an area where the incision is exposed to bending stresses. And that can lead to wound breakdown or at minimum of widening of the scar. So things that I've done and I've learned over the past few years is that maybe we should take our incision in a different orientation. And I've been helped by talking to other minds from Europe where they've been doing this for a number of years and now is slowly starting to creep into the United States, that these transverse incisions, or you'll commonly heard them referred to as bikini incisions. Now, bikini just kind of describes the orientation. The incision isn't technically in a bikini line. It's not high enough up directly in the crease of the hip to where if you were wearing a bikini that it might be covered up. All that means is the incision is transverse. Now what this does is this puts the incision away from the anterior hip crease, so it leads to fantastic healing, very, very quick healing. It also leads to nice scars, because scars in a transverse orientation heal much smaller and thinner than scars in a vertical orientation. It's something that every physician has learned about way back in medical school, called Langer's lines. Langer's lines are the orientation of our connective tissue in our skin. And so incisions made parallel to Langer's lines heal very fast and very quickly. Incisions made perpendicular to them don't heal as well. Now, there are certain parts of the body that we always adhere to Langer's lines, and there are certain parts of the body that we've just kind of neglected over the years. And when I'm talking about years, I mean decades, way before I was ever in medical school. But now we're starting to creep back to basic science, and we're starting to take these Langer's lines back into consideration. And I can tell you from experience, and I've done over 11,000 total hip replacements, incisions in this transverse orientation, or this bikini orientation, heal fantastic. They lead to less complications with the wounds, which leads to less complications with infections, which leads to happier patients, and frankly, happier me, because my whole goal is to get you through a surgery without a complication. That's the only reason I'm here. And if I can do something as simple as a skin incision to make it happen, that's what I've done. And 10 years from now, there might be something else out there on the horizon. But right now, as we sit in 2023, that's been the biggest thing that I've noticed in 17 years that's made for better patient outcomes and happier patients and less stress for me in my practice. If you guys are having hip troubles, we'd be glad to check you out, take some x-rays, and go over anything that you want to know about the details of the incision or the implants and make your hip pain go away. Thanks, guys.